Hello, fellow dental professionals. We are here to talk about the future direction of periodontal maintenance relating to digital radiography and CT scanning. Periodontal disease is the inflammation of the hard and soft tissues that results in attachment loss and destruction of bone. Diagnosis depends on clinical signs and symptoms. However, radiographs are an additional valuable tool. Clinicians can use digital radiography or cone beam computed tomography scanning. Digital radiography produces 2D images that show buccal lingual perspectives and are converted electronically. This eliminates processing, has less radiation, and shorter exposure time. Software allows adjustment of contrast, density, size, and zooming in on an area of interest. Digital radiographs are an important component of assessment, diagnosis, and treatment planning for those with clinical evidence of periodontal destruction and can be used in all stages of care. These images can identify caries, endodontic, restorative, and prosthodontic conditions, which can impact treatment planning. Probing pocket depths and measuring recession is vital. However, radiographs assess key information that can't be obtained clinically, such as bone loss and defects, furcations, and developmental anomalies. Other findings include morphologies, endodontic lesions, and length of the root. Clinical attachment loss is the calculating tool for determining severity of periodontitis, but remaining root support is another major estimation provided by radiographs. Some etiological factors of periodontal disease, such as calculus, incompatible restorations, root features, and cemental tears, may also be found. Periapical and panoramic images are routinely used for evaluating bone levels. Full-mouth surveys of periapicals have been considered a gold standard, and the same features of interest can be found on panoramic images. Limitations include the superposition of anatomic structures and projection geometry of the X-ray beam. This may cause magnification, distortion, and inaccurate diagnosis. Obscurities are found on furcations and buccal and lingual bone defects. Therefore, the use of 3D images has increased. CBCT enables clinicians to obtain 2D and 3D images. All CBCT units provide axial, coronal, and sagittal multiplanar reconstructed images without magnification. These images view the teeth, jaws, and surrounding structures, which helps improve treatment planning. If settings are set correct and the client doesn't move, these images are extremely accurate. The client is positioned supine, standing, or sitting. The X-ray source and detector rotate around the head and complete a digital model that appears on the computer. Software allows for 2D, 3D, and panoramic views of the mouth and head and options to help focus in on areas of interest. Only dentists are able to prescribe, order, and take dental CT scans and must register with the Royal College of Dental Surgeons of Ontario. Dentists who want to install and operate a scanner in their facility must obtain a permit that is renewed annually. CBCT has high resolution, allowing for accuracy and precise measuring. Images can pinpoint the exact location for a procedure and capture pathology, infections, nerves, and musculature. CBCT can assess the amount and shape of alveolar bone destruction. It evaluates marginal bone contouring, bone quality, buccal and lingual bone defects, dehiscence, fenestrations, and furcations. It also assesses pre-surgical implant planning for anatomic landmarks, diagnostic and treatment outcome evaluations, post-surgical results of regenerative therapy, and observes bone graft healing. CBCT can measure gingival tissue and the width of facial, palatal, and lingual gingiva. It can also assess lesions, deep pockets, the lamina dura, and changes in periodontal ligament space. It is important to note that CBCT is best used for mineralized structures. CBCT should only be used where 2D imaging is insufficient. It has a higher cost and radiation exposure, and metal artifacts such as restorations and implants cause streaks and dark zones, which affect image quality and may mimic disease. Benefits of diagnostic imaging includes detection of diseases and conditions that can't be identified clinically, confirmations of lesions and foreign objects, and evaluation of growth and development. This assists in accurate diagnosis, prevention of further disease, and an appropriate treatment plan. As you can see, here is a client with a probing depth of 10 millimeters. Digital radiographs were used to detect bone loss. Further 3D imaging was used in the same area to gather more information for an accurate diagnosis. In conclusion, digital radiography and CBCT, combined with assessment of clinical probing depths, attachment levels, and alveolar bone levels may increase the ability to determine the treatment outcome following periodontal therapy. We hope you enjoyed this video on periodontal maintenance and diagnostic imaging. Thank you so much for your time.